on the 5 o'clock news, Dr. Suraj Saggar, Chief of Infectious Diseases at Holy Name Medical Center in New Jersey. He joins Steve and Natasha live to discuss ways to help lower blood pressure, plus why cutting out carbs from your diet may not be the best idea.
In Fox 5 Health News, nearly half of all Americans have hypertension, and experts say most people don't do anything about it.
All right, joining us now, Dr. Suraj Saggar, Chief of Infectious Diseases at Holy Name. Doctor, thanks for being here with us. Walk us through exactly what hypertension is first, and then what this study found.
Yeah, absolutely. So hypertension is elevated blood pressure, and there's two numbers. I always tell my patients a systolic or upper number and diastolic or lower number. The upper number is how much pressure your heart has to beat against, and the lower number is the pressure when your heart relaxes. And the issue is that most people are walking around not knowing they have elevated BP or blood pressure or hypertension. Almost about 47%, so almost 1 in 2 Americans would be considered either hypertensive or pre-hypertensive, which means they're at risk of developing hypertension. And the key here, Steve and Natasha, is that this is called, in the medicine, the silent killer. There are no symptoms early on. People can walk around for years with elevated blood pressure and not know it. The problem is downstream, all the problems it causes: heart disease, kidney disease, increased risk of stroke. So this is really a major issue. And what this study has shown is not only are people not knowing they have hypertension, but those that do know they have hypertension oftentimes are poorly controlled. That means despite lifestyle interventions, so lifestyle can be things like eating less processed food, eating less salt, drinking more water, avoiding alcohol, avoiding smoking, of course losing weight. And if those lifestyle changes don't work, then they move on to medications, because you can be very effective. There's many classes of medications, so we have many different medications we can try for people that can tolerate and be effective. But for the vast majority of people, they are not well controlled. So this is certainly a major issue. This is a silent epidemic, because oftentimes people don't realize until they've had a stroke, a heart attack, or they go to the doctor and realize, gee, I have kidney disease, that they realize the seriousness of this uncontrolled hypertension.
It is very concerning. Doctor, I want to go to our next topic now. So a low-carb diet may be a quick way to lose weight, but experts warn doing so for a long time could set you up for health risks. So let's start with, what are the benefits of cutting out carbs from your diet?
So undoubtedly, it is very effective at losing weight. Studies looking at obesity going back to the 1950s have shown that, and then it was made popular in 1972 with the Atkins diet, which I think we've all heard about. So there's no doubt they can be very effective for some people. It can increase your good levels of cholesterol or HDL. It can lower your triglycerides or fats. It can help people lose weight if you're obese faster than it can with other diets. So there is some good aspects to it. I think you have to balance the good and the bad. The bad being, it's very hard for the average person to stay in a low-carb diet for long periods of time. After a few months, maybe they're trying the holidays, for a wedding, for a special occasion, it really becomes very hard for the average person to have the willpower to avoid carbohydrates. And they may substitute, the problem is they may substitute that with animal fats, saturated fats, which are bad for people, obviously. It can increase your cholesterol, it can increase your triglycerides, it can lead to a whole host of problems. So, of course, the quick question to answer is, what should you do? The idea is not to necessarily count your carbs, but really count the types of carbs you're taking. Look at the complex carbohydrates. Think fruits, vegetables, legumes, whole grains, things that take a time in your body to digest so they don't cause insulin spikes. Avoid refined carbohydrates like white sugar, like table sugar, like white bread, all the things that people like, unfortunately. Those are things that really cause damage. But carbohydrates have a lot of fiber. Fiber is good for the microbiome. The microbiome is the bacteria in our guts. Those things help us to all different metabolic processes in the body. So it's a tale of really not focusing so much on the type of the carbohydrates itself, but really focusing on the type of carbohydrates.
Yeah, makes sense. All right, doctor, thank you so much for the advice.
And we'll be right back with more.